Welcome to Adapt NCLEX. NCLEX review questions. We're going to use critical thinking, test taking strategy, including pharmacology review. Let's get to it. Test taking strategy for nursing students and the NCLEX. Question. How do you answer question? Read it from the back and focus on the buzzword. Which action should the nurse take first? That is the buzzword. Then what? A client with DKA is receiving IV insulin therapy and IV fluid. The nurse notes that the client's serum potassium level has decreased from 6 to 3.5. Which action should you take first? Stop the insulin infusion immediately, notify the healthcare provider of the potassium level, administer potassium supplementation as prescribed, and recheck the lab value. What do you think? If you're taking care of this patient, go for the buzzword. And the buzzword first thing is what? First. Second, DKA. Third, we're giving the patient insulin and IV fluid. And now potassium is decreasing. You ask yourself, a DKA patient, does they need insulin therapy and IV fluid? Yes, that's taken care of. And then what is happening? Potassium is decreasing from 6 to 3.5. Ask yourself, based on your content, what does that mean? If I give you insulin, your potassium is supposed to drop, right? It drives potassium inside the cell. That's why we use it in DKA. At the same time, we got to be mindful of the potassium in the glucose. At this point, we have 3.5. This is what happened in DKA. Stop the video, answer the question, let me know what you think, and then play the video and see how to approach it. This is usual. When I give you insulin, your potassium level is supposed to drop. In DKA, you got to be careful. You don't drive the potassium too low. 3.5 in the DKA is what? Hypokalemia. What do you want to do? Do you stop the insulin? Do you notify the healthcare provider? Do you give them potassium or recheck the lab work? One is a DKA patient. You can't stop the insulin infusion. They need the insulin. You don't need to notify the healthcare provider because they already told you. That's the management of what? DKA. You already have all the lab work, all the medication that you need in the management of DKA. Calling the provider, that means that you don't know how to manage DKA. You should give them the potassium that is prescribed based on the management of DKA. And you should not check the lab work again. Therefore, number 3 is your right answer. This is the way you should go about each question, break it down into the lowest level, and think about the key concept associated with it. Administer potassium to prevent hypokalemia because at 3.5, we're getting closer to low level of potassium, and that can cause arrhythmia. The first thing the nurse should do is to give them potassium. Next question. Which client statement indicate the need for further teaching? A client with Parkinson's disease is prescribed Carbidopa-Levodopa. If you're going to take the NCLEX or in nursing school and you study about Parkinson's disease, this drug you're supposed to know. This drug you must know. This drug you should know everything about it. Carbidopa-Levodopa pharmacology review. I should change position slowly to prevent dizziness. Does that need further teaching? It may take several weeks before I notice improvement. Does that need further teaching? Take this medication with high protein meal to help it work better. The medication may cause my urine and sweat to turn dark in color. Test taking strategy, go for the buzzword. Test taking strategy, I want you to go for the buzzword. What is the buzzword? Carbidopa-Levodopa and further teaching. That's all. This medication causes what? Dizziness. Therefore, you should change position slowly. It may take time to work. Therefore, may expect several weeks before I notice improvement. It's a good thing. That's no need further teaching. I will take this medication with high protein. I hate protein. You should not take protein with this medication. A low protein diet is reasonable. The medication causes nausea, so it's better to have something in your stomach, but low protein as much as possible. The best is to take it on empty stomach, but if you can't, take it to some food, but not high protein. It changes your urine color. Therefore, this is expected. This teaching is expected. You're supposed to tell them. Therefore, what is the right answer? Avoid protein as much as possible when you're taking Carbidopa-Levodopa. This is the concept you have to know. Every question, I'm going to give you a concept at the end, and you should write it down. Write the concept down. When you see carbidopa, this is the number one thing they're going to ask you about protein diet. So watch for it. A client is experiencing uterine atony unresponsive to what? Oxytocin. The provider prescribed Carboprost. Which client history should the nurse report before administering? Type 1 diabetes, asthma, multiparity, and preeclampsia. History of preeclampsia, prior preeclampsia. Go for the buzzword. Patient has what? Uterine atony. That means the uterus may be buggy, it can contract. We can use medication. That medication is Pitocin. Now the Pitocin is not working, and we prescribe what? Carboprost, another medication that can contract the uterus so that it will prevent bleeding. But what is the problem? There is contraindication in the use of this medication. Which of this should you worry about? The concept associated with Carboprost that is good to know for the NCLEX and nursing school is what? This is a pharmacology, maternity pharmacology question. It causes bronchospasm. If it causes bronchospasm, which history should you question? Of course, asthma is number one. Bronchospasm is big in the patient with asthma. Therefore, the nurse should verify that this patient does not have asthma before giving them the Carboprost. Number 3 is done. What is your score? Put down in the comment and let me know how you're doing. But this is test taking strategy, NCLEX review questions, NCLEX practice question, and some pharmacology. This is maternity pharmacology. Which instruction the nurse should give? This is also a pharmacology question, but hematology. A client taking warfarin is scheduled for surgery next week. What do you know about warfarin? Continue taking your warfarin until the day before surgery. Stop taking your warfarin about 5 days before surgery. Double your warfarin those 2 days before surgery to prevent blood clot. Stop taking your warfarin day before surgery. Think about it. What is the content? Buzzword is warfarin. It's a medication that causes bleeding, anticoagulation. It lasts for a long time. What is the stop time before surgery? Minimum 5 days. Aspirin, 7 days. Know this, write it down. Every time you see it, that's the teaching you provide them. You stop it at least 5 days before surgery. Don't worry about blood clot because we're going to give them prophylaxis before surgery, like heparin. Therefore, the content, warfarin need to be held at least 5 days. Once again, pharmacology, NCLEX review question, NCLEX practice question, test taking strategy, and think critically. These are the way NCLEX will give you question, short and straightforward, but you have to think. And let's care for a client experiencing acute asthma exacerbation. What is the buzzword? Acute, not asthma exacerbation. Forget about the asthma exacerbation. Focus on acute. If you focus on asthma exacerbation, you can get this question wrong, right? Acute is the key, which ordered prescription, the next question. That means one medication cannot be used in acute situation. Salbutamol, ipratropium, Mantulucas, metaprednisone. What do you think? Bring your content. Analyze the question. Go for the buzzword, acute. And the next one, ask you question. What are the medications you need? Acute asthma exacerbation, steroid, and bronchodilator, in addition to oxygen. Salbutamol. You may see this in the question. You're looking for albuterol. I give you a derivative of albuterol. Salbutamol is the same thing as albuterol. That is check. Ipratropium is an anticholinergic, but it's a bronchodilator. Mantulucas, no. It's a long-acting medication. It's a leukotriene medication. We don't need it in acute situation. It's used for inflammation, but it's for what? Long-acting. And the steroid is for acute asthma exacerbation. Therefore, the one we should question is number 3. But this is the way you should approach the question. You can see that it will be an easy question. The client with a new diagnosis of what? Addison disease, circle it. That's your buzzword. It's being assessed by the nurse, which finding is most concerning and require immediate follow-up. What do you mean? Which finding is most concerning and require immediate follow-up? Fatigue and weight loss, do you expect it in what? Addison disease patient? Hyperpigmentation of your skin, do you expect that? Mean arterial pressure of 50, do you expect that? And salt craving, what is Addison disease? That means destruction of the adrenal gland. And therefore, what do you lacking? Aldosterone. If you lacking aldosterone, what is going to happen to you? You also lack steroids. What is going to happen to you? So I have aldosterone problem. I'm lacking steroid. I'm lacking monoamines like epinephrine. If you like aldosterone, what is going to happen? Your sodium is going to be low and your potassium go up. Therefore, you're going to have salt craving. If you're lacking steroid, what are you going to do? You're going to what? Lose weight, and you're going to get fatigue, unexpected finding in this patient. Hyperpigmentation is associated with what? ACTH pigmentation, unexpected finding. Addison disease, because they lack aldosterone and steroid, they're going to be hypotensive. Mean arterial blood pressure of 50 of mean arterial pressure of 50. This is hypotension. And therefore, which one is most concerning? Hypotension. Break it down into the little things and you'll be able to figure out the answer. Number 3 is your right answer. But these are test taking strategy and NCLEX review questions I want you to master before you take your NCLEX or in a nursing school. And this is content review in addition to pharmacology. And therefore, MAP of 50 is a hypotension. Which option is appropriate for the client? And then is planning a snack for a client with what? Acute glomerulonephritis. Which option is appropriate for the client? Potato chips, pickled vegetables, apple slices, and what? Ham sandwich. You may see this question on the NCLEX. Somebody had it recently and wanted to know how to answer this question. They are not hard, but the test taking strategy and critical thinking is a big word. Glomerulonephritis is a big word, but don't let it distract you. Look, if you divide this into two, you know that nephritis is what? Kidney. It's a kidney problem. If your kidney is in trouble, what is wrong with it? Bad stuff happening. But what is it? Nephritis, infection, inflammation of the kidney, right? Something bad happening to your kidney. If you don't know, you don't have to know the details about what is glomerulonephritis to answer the question. Say your kidney is in trouble. If your kidney is in trouble, then what is going to happen? You can filter and then you can retain fluid. You become hypertensive. All the signs and symptoms of what? Renal failure. So I can say I'm in renal failure. That's all. Do you want the patient to have potassium? No. Do you want them to take too much what? Sodium? No. Otherwise, they will retain what? Fluid. Therefore, for this patient, they should have what? Sodium. Potato chips, too much sodium. Pickled vegetables is fine, but if it's pickled, too much salt. Apple slices is good. Ham sandwich, too much salt. Therefore, this is the way you should approach this question. Number 3 is the right answer. The low sodium and potassium, this is kidney injury. If you don't know glomerulonephritis, that's the way you should take it every time you see in the question. Consider it as kidney injury. Which prescription should the nurse anticipate from an ACP? A nurse is caring for a client whose lab result shows potassium of 7.2. That is low. I can tell you it's low. And if it's low, everything goes up. You have spasm, you have tetany, you have bronchospasm, you have paresthesia. You can have cardiac arrhythmia. What do you want to do? Decrease it. What do you think? Which prescription should you use? Anything that will increase your calcium. Alendronate, do you think it increases calcium? Savilamin, does it increase calcium? IV phosphorus sulfate, does it increase calcium? IV magnesium sulfate, does it increase calcium? I said this question to let you think critically. Stop the video, put your answer down, but think about it. I need something to increase calcium. If I see something that decreases calcium, I'm not picking it. Therefore, what do you think? What do you want to pick? Which answer choice do you want to pick? Alendronate, what? It block release of calcium. Therefore, it's going to decrease your calcium. You don't pick it. It's bisphosphonate. We use it for osteoporosis. Savalomate is used to decrease specifically phosphorus. It does not affect your calcium. IV phosphorus, if I give you too much, phosphorus, there is a inverse relationship. Too much phosphorus will cause decreased calcium. Therefore, that will decrease your calcium more. Even if you don't know number 4, you know 1, 2, 3 are wrong. They're going to decrease your calcium. Therefore, I'm going to pick number 4. A low magnesium can lead to a low calcium. So if I give you more magnesium, I can increase your calcium. This is a test-taking strategy. Thinking something you don't know by using strategy to pick out all the wrong answers, and you're left with that. This is how you answer questions that is difficult. 8 questions. What is your score? Put down in the comment. Let me know which question trips you, and I'll go over it in the next video. A client with acute pancreatitis is at risk for what? Hypovolemic shock. What is shock? Hypoperfusion. That is all. Anything that causes hypoperfusion is shock. Which assessment finding indicate hypovolemic shock? Hypotension, bradycardia, hypotension, tachycardia, hypertension, bradycardia, hypotension, warm skin. What do you think? This is test-taking strategy. At the same time, content review on shock. If you have hypoperfusion, your blood pressure goes down. But when your skin is warm, it's not hypovolemic shock. When you have hypovolemic shock, your skin becomes cold and clammy. Warm skin is a distributive shock. That means you are what? In sepsis, like that, right? Or anaphylactic shock. Therefore, this is wrong. Hypertension and bradycardia. This is what? Cushing phenomenon when you're having what? ICP issue. Therefore, this is gone. Hypotension and tachycardia is associated with what? Shock, because when your blood pressure goes down, you want to improve your cardiac output, you increase your heart rate. And this is cardiac output equal to stroke volume times heart rate. If you need more on this, check out Adapt Class. I have a good video on shock that you can watch. Therefore, cardiac output goes down because you have hypotensive associated with the stroke volume. I got to increase your heart rate to increase your stroke volume. Therefore, this is much better. Hypotension and bradycardia, what do you think? This is neurogenic shock. The question asks what? Hypovolemic shock. This little question has a bunch of shock content. You should get yourself familiar. That is neurogenic shock. Therefore, the right answer is number 2. And that is the way you approach this particular question. And I know you got it. And then it's assessing the client suspect of what? Having antisocial personality disorder. Buzzword, antisocial, against society, against society. It doesn't mean they don't want to go out. The buzzword is what? Antisocial, against society. Society want to respect rules. Society does not want to break rules. Society want to do good. Which one it is? Intense mood swing, fear of abandonment and impulsivity, disregard to others, lack of remorse or manipulative, excessive worry, perfectionism or fear of criticism, detachment from social relationship, emotional restriction, and preference for isolation. This is mental health, psych mental health, testing your personality disorder. What do you think? Antisocial disorder is somebody who breaks rules. Therefore, disregard for others and lack of remorse and a more manipulative is key. If you have mood swing and a fear of abandonment and impulsivity, what do you think? What do you call these people? Borderline personality. Excessive worry, perfectionism, and a fear of criticism. These are obsessive compulsive disorder patients. And those who are detached from society, emotional restriction, they are what we call schizoid type kind of behavior. Therefore, what is the right answer? Number 2. 10 questions. This is concept way of answering questions. Take care of yourself. If you need more, check Adapting Class for more content like that, or subscribe so that when I make new video, you get access to that. Take care of yourself and good luck.